Welcome to the premiere episode of Season 4 Empowered Voices Recovery to Resiliency. I'm Amani Wilson, joined by my wonderful, fabulous co host, Dr. Farzad Kamyar. In this episode, we're going to talk about cannabis use during pregnancy, an issue that has become increasingly complex as cannabis legalization expands across the country. Many women today are hearing mixed messages about cannabis. Some believe it's a natural or safe alternative for nausea, anxiety, or sleep. Others are unsure how cannabis might affect pregnancy, breastfeeding, or recovery from other substances. Today, we want to separate fact from fiction by exploring what current research tells us about exposure during pregnancy and what expecting mothers should understand when making decisions about their health and their baby's health. We're very fortunate to have a leading expert in maternal fetal medicine with us today. Dr. Farzad, take it
Yeah,
away.
thank you, Amani. Joining us today, Dr. Torri Metz, professor of obstetrics and gynecology, also division chief for maternal-fetal medicine and vice chair for research in obstetrics and gynecology at University of Utah Health. It's where I did my training. Dr. Metz is a nationally recognized expert in maternal-fetal medicine whose research focuses on pregnancy outcomes and the impact of substance use during pregnancy. Her work has contributed important insights into how cannabis exposure may affect placental function, fetal development, and long-term health outcomes. As cannabis becomes more widely available and socially accepted, her research is helping clinicians and families better understand the science behind cannabis use before, during, and after pregnancy. We are so lucky to have you, Dr. Metz. Thank you so much for joining us today.
Oh, yay!
Thank you both. Yeah, great to be here.
I'm
Thank
super excited.
super excited. Look, w- beyond the number of reasons that I'm excited, oftentimes you hear me talking about in our series, right? All these things like stats and here's what the evidence shows and
Yes.
evidence-based practice in medicine. Dr. Metz is the one that is creating that evidence. All right. So we're with a creator here.
Yes.
And really, really, this is the stuff that helps guide all of medicine, all what we call evidence-based practice, evidence-based medicine. Thank you again, Dr. Metz, for being here.
I'm super excited because, well, we all know I am in recovery. My drug of choice was meth. But with my first child, I went through a lot. So marijuana was my go to, honestly.
Sure.
So
Sure.
I'm really excited to educate myself just to, see what all this data has entailed.
Yeah. Okay, so here we go to kick things off. Understanding cannabis and pregnancy. Dr. Metz, can you give us your best summary of what we currently know about cannabis use during pregnancy?
That's a great way to frame it because what we currently know, I feel like, is constantly evolving in terms of cannabis use in pregnancy. It's a little bit of a challenging field to study because we can't do what we would normally do, which is big randomized trials where we randomize people to receiving cannabis or not receiving cannabis and see what happens to their pregnancy. That's not something that's ever going to happen. And so we rely a lot on, observational studies, trying to understand if patients use cannabis during pregnancy, and that's where this evidence is coming from. So with that caveat, I would say that what we know now is, it seems like cannabis does affect growth of the fetus in utero, and that's come up pretty consistently across studies. There are also some data that look at increased risk of neonatal ICU admissions, some data that would suggest an increased risk of stillbirth, and then, evolving area that people are, still really investigating is what are the, longer term implications in terms of neurodevelopment and the offspring outcomes in the long term.
Yeah, so a lot, right? So we're talking about risks during pregnancy, but Dr. Mess, it also sounds like folks are looking at risks after, right? So, like you said, sort of that long-term development. Can you tell us a little bit about your right foray into this field? What is it that you have studied and maybe published some really important papers on?
Yeah, I started studying cannabis actually when I was in Colorado because it became legalized there when I was working as a researcher, early investigator there. And a lot of patients started asking me about if it mattered if they used cannabis during pregnancy. And I looked at the literature at that time and I felt like I didn't have a great answer to that question. So I started to really do work in the area, and a lot of the work that I did initially revolved around just understanding how we can best approximate amount of exposure during pregnancy. Because we know that people don't necessarily know or remember or tell us how much cannabis they use during pregnancy. And so that made it hard to study the effects of it. So a lot of my early work was really just trying to figure out how we can best measure it. And ultimately, we found that we could best measure it in the urine. And so that, ultimately, after many steps, led to the publication you're probably talking about in the Journal of the American Medical Association, or JAMA, where we really tried to quantify cannabis use across the pregnancy by looking at the amount of cannabis in the urine at multiple time points, and then tried to look at how that correlated or associated with outcomes for the baby and the mother.
Yeah, and what did y'all find?
Curious to know too.
Yeah, I mean, we found, I feel like we validated some of the work that was already out there, and perhaps what we hope is a very scientifically rigorous way. We were able to demonstrate that there was an increased risk of adverse outcomes, predominantly babies being smaller than expected. Um, but really also looking at other things that are mediated by the placenta. So, we looked overall, needing to be delivered early, for obstetric complications, being small for gestational age, developing hypertension in pregnancy. All of those things are kind of pathways that go through the placenta. And what we found is that, there was an association between cannabis use and these adverse outcomes. And it was driven mostly by poor fetal growth, or growth less than we would expect. And we also found that, it was really the patients who had ongoing and heavier use that had a higher risk of these outcomes, which, made us more convinced that this was, a real finding. This wasn't just an association that, could maybe be attributed to something else. That when we really looked at dose and frequency and amounts in urine, we saw an increasing risk of these outcomes with more use, higher use, more frequent use.
Dr. Metz makes an important distinction is like in the world of sort of science, you can have things that happen chance, right? Chance.
Yes.
This will like happen. And that's the point of all these studies is doing a lot of math, a lot of statistics, and looking at maybe a lot of data points and patients to see, is this explained by chance, random, or is this explained by something?
It's the data
And
backing it up.
in this world, I love that this is sort of how it played out because she mentioned because it looked like the higher the dose, the more exposure folks had to cannabis, that resulted in higher rates of,
The
and that
adverse
does a
effects.
really good job at sort of calming questions that,
Yes.
is this just random? When you see trends like that, oftentimes it leads more confidence into the, it's probably because of this X, Y, and Z,
We have
and that
added to
and it
that the receipts,
the
basically.
receipts. Yeah.
I
Yep.
wanted to ask you, right now, because I know you said in the beginning it was really hard to basically track all this. Have you, right now where you are in your data and study, have you discovered anything more along the lines in kind of like the other developmental stages of your childhood development or adolescence by any chance?
Yeah, that's a great question. I have not yet extended the work that I've done beyond those initial outcomes of the pregnancy, but other people certainly have looked at longer term outcomes. And we would hope to, also examine that in our cohort. But, in the people that have looked at it so far, there's a few big studies that had followed children longitudinally after exposures during pregnancy. Most of them are actually done in the '80s, so they're, older studies, where they followed, the moms during the pregnancy and then followed them into the, postpartum time frame and then followed their offspring as well. And there's been some signals with that data as well as some other large data out of a cohort called ABCD, which is a large cohort that's examining sort of neurocognitive outcomes in children after a variety of different exposures that demonstrate that there does seem to be some problems potentially with attention later in childhood. That's something that has come out in a few studies. I think the thing that's been really challenging about this and when, people have done large examinations of the literature on this is that it's really hard when a child is 4, 6, 8, 10 years old to say what we're seeing now is because of the exposure in utero. Because, there's so many things that happen between the time a child is born and the time they're in late school age. So the tricky thing with those studies and why I think there's been some hesitation to say like, "Oh, yes, we know that cannabis use is associated with attention deficit, attention hyperactivity in the offspring," is just this issue with, well, was it really the exposure in utero, or was there something different during the rest of their childhood that potentially contributed to this as well? And that's called confounding, and that's something that we have in any human studies. There's a lot of other things that are happening in life and in the environment and different exposures that, it's hard to account for every single one of those other things to really isolate that exposure, that cannabis exposure. But it does seem that, that is something that has been coming up as an association that, there does seem to be some problems with attention in these kiddos as they progress into, childhood and young adulthood. And also potentially, some psychotic like illnesses has come out more recently in some of the large database studies.
Thank you for that.
Yeah. Wow. Okay. Yes. Yes. Thank you. Right. So well said. Challenging.
Right.
Challenging, like Dr. Metz had mentioned, and this is a question that I actually have for Dr. Metz is, specifically when we talk about cannabis, a lot of times we call it cannabis, we call it marijuana, I mean,
Oh,
a
no,
million
it
different
is.
names,
Yes.
but for the most part, sort of the chemical compound, let's call it THC, is sort of the one that, yeah, Dr. Metz, would you say that's the one a lot of focus is on? That's part of cannabis and marijuana, THC, yeah. And we won't talk about fancy Delta 9s and all that kind of stuff. Forget all that. Uh, okay. The
Details.
THC. Um, one point that Dr. Metz had mentioned was a lot of these studies have already been conducted and are looking at some folks that were sort of, let's call it older data. And one of the issues is when you're looking at cognitive things from a kiddo's perspective, it takes time, right? So that ABC, I think maybe 9 and 10, so we're talking minimum of a decade ago is when these individuals were born. Yes.
Yes.
And now we're going back and we're looking. All right, then caveat, and this is where I'll get to the THC, is I'm extremely concerned, specifically when it comes to THC, because we are seeing, and this is what the evidence shows, that the strains now are extremely more potent. So
Yes.
the weed and the cannabis now
Yes.
is it, and I'll use terms like fold and percent, but we're talking, let's
No.
call it 500% to 1,000% more
Right.
potent than what marijuana used to look like, or specifically
Mhm.
THC. And so I'm really concerned that as folks that are, for example, enrolled in Dr. Metz's study, and if we get to the point where now those kids are 10, were they exposed to cannabis that is now has this higher potency THC? And what are things going to look like? And it's possible that we see higher rates of things like
Mhm.
ADHD and all those kind of things because we tend to think it is dose related, dose exposure. So interesting things down the line, a concern that I have. But Dr. Metz, now coming back to THC, for our viewers and listeners, can you talk a little bit about THC? What is it? And when we're talking about use during pregnancy, does it do things like cross the placenta? Is baby actually getting THC?
Yeah. I think that's a really important point that people need to understand. So thanks for bringing it up. I mean, THC is a metabolite of what people use, and they think about using marijuana or smoking weed or whatever, or eating edibles, whatever it is that they're in whatever way they're consuming these products. THC is a metabolite of that product that is processed as part of the body clearing, that drug. But the important thing about it and the way that cannabis or marijuana works and the way that people enjoy using it recreationally is because it interacts with receptors that people have in their bodies. So there's cannabinoid receptors, and when people are consuming this product, it interacts with those receptors. The issue during pregnancy is that that same product can, those metabolites cross the placenta. They interact with the receptors that are involved, that are around during pregnancy. There's a lot of those that are involved actually with the formation of the placenta, which is why, one of the reasons that people think that potentially this affects fetal growth is that early on in the pregnancy, there's maybe interaction with those receptors as the placenta is forming. And then from a neurodevelopmental perspective, those endogenous cannabis receptors, those endogenous cannabinoid receptors, are interacting with that product that's coming, and they're very those particular receptors are typically very involved in neurodevelopment because there are natural cannabinoids that the body has, that are supposed to be there, that aren't consumed, that are very involved in things like creating neurons in the fetal brain, forming the placenta. And the concern is that when women are consuming these drugs, that exogenous consumption also is crossing and is interacting in those receptors in a way that isn't anticipated and could potentially interfere, with all those pathways. It does, yeah. Yeah. Yeah, and we know it can cross the placenta because we've been able to measure it, in umbilical cords and, fetal urine, ways that we know that metabolite has crossed the placenta. So we know that it's crossing, and then the concern is that it's interfering with those natural systems, natural cannabinoid systems that are supposed to be there doing things that then interact with this unexpected sort of exogenous or consumed, product.
Does it affect eating or feeding in young babies?
It's a great question. There have been um, there is some literature out there that sort of describes maybe a syndrome or a jitteriness that of babies who've been exposed to this, but that's not very well described. It's not well described like we see for, let's say, babies that have been exposed to opioids, where we see very specific, opioid withdrawal. Um, and so in terms of, like, how it actually affects the fetus in turn, or the neonate at that point, I guess, in terms of their feeding and, time after delivery, is hard to know. I mean, we do know that the metabolites do cross into the breast milk. So, I mean, I think that's another piece that draws a lot of controversy and, a lot of discussion, after delivery, in terms of what makes sense if patients are going to continue, or if women are going to continue to use cannabis, should they breastfeed? I think there's a lot of benefits to breastfeeding. We know that. We know there's a ton of benefits to breastfeeding. And so that's that makes this a challenging conversation. I mean, we definitely tell people that they should not continue to use cannabis if they're going to breastfeed. Because we do know that it crosses into the breast milk. But I think where the controversy comes up is, well, if they're going to continue to have intermittent use, is it really better for them not to breastfeed at all, when we have all these other known benefits of breastfeeding. And I do understand that controversy, and I hear that controversy a lot. I mean, I think our job, as healthcare practitioners, is to tell patients that it does cross and that we'd advise them not to use, and that it takes a really long time for those metabolites to clear.
I was just
Exactly.
thinking about that.
Yeah.
That was going to be my follow-up question. If somebody was, utilizing or consuming cannabis during pregnancy, what would be the cutoff time if they wanted to breastfeed? Because I know it does take a long time for it to clear your system.
It does. And I think, this idea and this question comes up, right? We tell people, "Oh, just pump and dump," "Oh, you can have some wine, but then, you just pump that episode of breast milk and get rid of it and don't feed it." Unfortunately, that doesn't work that way with cannabis. It hangs around for a really long time, and I think, we think that's probably because there's so much fat in, breast milk, and and cannabis likes to hang out in fat and sits around in fat a lot longer than it does in other tissues, and so, when we looked at this in a population of women in, Colorado, we found that, it was persistent. Those metabolites were persistent in the breast milk for even up to 6 weeks.
This is exactly why for those that are chronically using cannabis, if you were to present and provide a urine sample, there's a chance that it detects positive, even though you haven't used in 30 days, because it's just hanging out in your fat tissue. And as it slowly leaches out, it's ending up in your urine as it's getting cleared, and you haven't touched the stuff in 4 weeks, 6 weeks, like Dr. Metz is mentioning. And so it does introduce a huge variable. So then are we saying don't breastfeed, but then we're missing out on the benefits? It's a sticky situation. It's a tough one.
Yes.
Yeah, it's a tough one.
I
Uh,
know you said that, this is just an off the wall question. I know you said that it's stored in your fat tissue. So if somebody is larger in size with more fat cells, it will stay in their system longer than somebody who doesn't have as much fat?
I'll let Dr. Metz have a go at it.
Yeah, we do think that there's differential clearance based on, body mass or, lean versus fat mass, because it does take longer to clear if you have, more fat cells, because the cannabis prefers to stay there and is stored there for longer. So it can take, in somebody with heavy use, several weeks to end up at the point where they would have a negative urine test for cannabis metabolites.
I'd like to shift a little bit to go back to what you had mentioned sort of early on was I got started with this in Colorado where it was legal. And here in Nevada specifically, we have legalized, right,
Yes.
recreational cannabis use as well. Dr. Metz, can you tell me or tell us what have you seen as sort of a shift that may have happened, or what are some influences on perception and acceptability when things become or when cannabis becomes legal? I'm throwing up air quotes sort of at the state level versus still not at the federal level, but yeah,
Yeah, I think we are seeing increases in use in pregnancy, and, a lot of people attribute that to legalization and just sort of the perception of safety that surrounds legalization. I think, we have over time, and as people have looked at, legalization both for recreational and medicinal use, rates of cannabis use in pregnancy have increased. It's hard to say, like, exactly if that's one to one, right? But certainly, we have seen uptrends in reported use with legalization. Now, how much of that is that patients just feel more willing to disclose use versus actually more use? That's a little bit tricky to sort out. I can tell you that when I was practicing in Colorado, initially when cannabis became legalized, a lot more patients started saying, "Oh yeah, I'm using marijuana," And then interestingly, it dropped off again in terms of reporting because I think patients realize that despite legalization, it was still a Schedule One drug, and so there was still an obligation for, reporting to social services, and so I think, so then we started to not hear it as much again. So I think it's probably, a combination of, a little bit more willingness to report, a little bit more of a perception of safety. There are surveys that look, something called National Survey on Drug Use and Health, where they survey, a cross-sectional sample of people and ask them questions about drug use and ask them questions about their perceptions of drug use. And certainly in that survey, there's been a big increase in the perception of safety of cannabis use in pregnancy. And so, to me, that's tough because it's like, it tells me we're not doing a great job maybe of educating, pregnant people about, cannabis use and that we think that there really is potential for harm there. We do a much better job with things like alcohol and tobacco and other drugs.
yeah, and exactly along those lines, can you comment on two sort of perceptions? Is that One is legal equals okay
Mhm.
and natural equals okay.
Okay, yes.
Share your thoughts.
Yeah, I mean, I think both of those arguments come up, right? People figure, well, if it's been legalized, it must be fine, right? There must be some presumption of safety if we're going to legalize a drug at this level. And then I think the natural thing comes up for sure. I mean, people say, oh, this is a natural, I'd rather do something natural than take a medication. It's like, well, I mean, tobacco is also natural. I mean, it's plant, it's grown. But we know, there's a lot of health risks of tobacco use. And so I try to, talk to patients about that, and they sort of bring up that they would rather use it than a medication, and really talk about, why. Why do they want what are they using cannabis for? Is there something that they're treating that maybe we can talk about other safe options for treatment that we have more data on in pregnancy?
Yeah, I mean, that's like, that is so much of what I think we end up doing when it comes to the topic, right? You hit the nail right on the head. Um, there are plenty of instances where legal, like Dr. Mentz had mentioned, does not equal safe, and
Yes,
natural does not equal safe. I mean,
yes.
you can come up with countless examples on, um, plutonium that we use to create nuclear weapons is highly radioactive and it's natural. It naturally occurs on the
Never
face of
heard
this
of that.
planet. My guess is that you would not want to consume that or be near that during pregnancy. So it does happen. But on the flip side of this is, and Dr. Metz had mentioned this, I think, is I sort of see it as an opportunity for us as healthcare clinicians, professionals to educate those that I sort of assume like you don't know about this because I don't expect that you have heard about this.
Yes.
I don't think that we're doing a good job, let's call it Dr. Metz at the national level to sort of I feel like we've done a pretty good job, like you mentioned, with tobacco and alcohol. I think most folks know that alcohol can be harmful, right, when you're pregnant. But I don't think we're nearly as close there when it comes to things like cannabis.
But do you think it's because it's just legalized and maybe those were legalized? Do you think that has anything to do to play? I mean, I know it's been used always.
Yeah, I mean, yeah, I think absolutely that's a component, and we're talking about duration of time. Yeah, so legalization of cannabis is only, let's call it recent in the scheme of things, recent. So we're not seeing folks that have been using this for 40 years, and now we're getting to see all the effects. But something like, alcohol exposure, you see it right there. And oftentimes, I think um, one of the positives, if you can call it that, with alcohol exposure is there is a syndrome where it sort of has like facial features and physical aspects that sometimes pediatricians can diagnose after birth. So sometimes they can look at a neonate, a
Mm,
newborn, and say, there are signs here consistent with what we call fetal alcohol syndrome,
I've
which
heard
means
of
that
that.
this fetus this newborn was exposed to alcohol in utero. We don't have that with I don't believe, right, Dr. Metz, that we have that with cannabis. So then it really does become, what do things look like in 20
I'm
years,
gonna be
right?
honest with you, going back to the fetal alcohol syndrome, where I used to work in a school and you could tell
You
the
could tell.
difference. Unfortunately, you really can. You can tell that, when a child has that because the behaviors are just so drastic
Yeah.
at times.
Yeah, and again, some of those other things come up as well. Like, is alcohol as natural as cannabis? You could argue no, because you have to, put together some ingredients and chemical processes have to happen in order to generate alcohol. Um, but not with cannabis, it's a plant. It's a plant and grows, and you either consume it, inhale it, those kinds of things. Um, so yeah, I guess fundamentally, Dr. Metz, I sort of use that as an opportunity for me to educate individuals on what are some things that you would tell a patient, like, hey, you're using cannabis. This is the advice that you would give the general population when it comes to using cannabis during pregnancy.
Yeah. I mean, I think the first step I'd take is really just trying to understand why they're using it, because a lot of times it's for anxiety, depression, nausea, sleep, other things that we can provide safe alternatives for. And then I just counsel them, that I recommend that they stop using it. And the reasons that I typically cite for them, and I try to be honest with them. We don't have all the answers, but that the evidence that's out there would suggest that there does seem to be poor fetal growth with exposure to cannabis in utero, that it does cross the placenta, that there are some studies that show an increased risk of stillbirth, which patients really get worried about. Um, that there, does seem to be an increased risk of needing admission to the neonatal ICU. And that there's, evidence that it potentially is affecting neurodevelopment and creating problems for the offspring in the longer term, in terms of, attention disorders. And typically when patients hear that, honestly, a lot of times they're surprised to hear that there's any evidence that suggests that cannabis is not safe. Um, and some of them say, "I just don't think I can stop using it." But a lot of them say, "Oh, well, I mean, I didn't know that, and I think I could stop." And some are successful and some are not, but I think, my job is just to talk to the patients about, what we know, to enable them to make informed decisions. And a lot of times I feel like they just don't even know. We don't have those signs on bathroom stalls like we do for alcohol, like, "Don't use alcohol while you're pregnant," that doesn't exist, for cannabis, and so, the dispensaries now do post signs about that, the products from dispensaries say that, but a lot of people aren't getting their products from dispensaries.
I mean, that's fundamentally what I do. We're different specialties, Dr. Metz and I. So Dr. Metz, again, is maternal fetal medicine, which is high risk obstetrics. And she did a lot of training, okay, to become what we call an MFM or a perinatologist. I am psychiatry. So I'm lucky in that a lot of my work is not interventions, surgical procedures, you name it, right, which Dr. Metz does a whole bunch of all the time. Um, for me, it's talking to people. And so really fundamentally, and you mentioned so many of these, in these instances, what I do is first and foremost, make sure I am expressing empathy,
Mhm.
compassion, and non-judgment.
Yes.
That wasn't a single medicine I prescribed or
No,
an intervention that I
nothing at
took.
all.
And then fundamentally speaking, to provide the knowledge base that I have based off of evidence that Dr. Metz has come up with. Yeah.
Mhm.
Inform the patient and then help the patient make the decision. Have them, and Dr. Metz mentioned, make an informed decision. And that's where I feel like I help the most, right? Is help them arrive at that. One of the techniques that I really love when it comes to the world of chronic disease management, Dr. Metz, I'm sure you've heard of this, motivational interviewing. There's so many different lifestyle factors that come into play for things like diabetes, high blood pressure, high cholesterol, substance use, right? Major
Yes.
depressive disorder. Our lifestyle types of interventions and motivational interviewing can be a very powerful tool. Fundamentally, what does that mean, Amani?
I was
It
just gonna
means
ask.
motivational interviewing is I'm going to ask you questions to figure out where you're at and what you understand and help clarify if there's anything there, and then have a conversation with you so that you can arrive at your own decision on what you want to do.
I love
I
that.
am not here to convince you of anything, right? To give you that knowledge base and then for you to say, okay, so I'm hearing that if I use cannabis, it can help me with some nausea. Maybe it helps me with my anxiety, but then it could potentially do some harms to
Mhm.
my growing baby. Yeah, I think I'm going to stop.
Mhm.
Okay, sounds good. How can we further support you? Or I think I am Dr. Metz mentioned this. I might struggle to stop. How can you help me? Cool. Let's talk about goals on that. Or I'm going to keep using at the same level. Okay. How do we mitigate that? How do we deal with that?
Mhm.
Those kinds of things. So, yeah. Um,
And the cool thing is there are a lot of other natural remedies that you can use for nausea, all those other symptoms that you do have, which is a good thing for those who
yeah,
are natural.
which is a good thing, and I won't get into the specific actual, like, prescription medications that we can use where Dr. Metz would likely agree that have safety profiles, right? That we know to likely be very safe during pregnancy. One of the keys is
Mhm.
Maybe we won't talk in absolutes for anything across the board, but what data does is it gives us a high level of confidence to make these statements. Yeah. Um, Closing, Dr. Metz, you ready? Let's focus on viewers and listeners. Someone's using cannabis. They're either pregnant or thinking about getting pregnant. What questions should they feel comfortable asking, or how should they approach that subject when they're seeing a specialist like you?
I hope that everybody would feel very comfortable asking any of those questions to their healthcare professional or, their doctor or their midwife or whoever they're seeing, related to their reproductive care. I mean, that's the place to ask these questions and get the right information. We've done studies where, we people pretending to be pregnant, pregnant women calling a dispensary and asking them for their input. They're not going to tell you a lot of the times to talk to your healthcare professional, but that's what we really do want people to do is, really work with their somebody they trust in the healthcare setting to give them the right information. And I know that sometimes, people don't have those, therapeutic relationships, but I think it is really important to try to establish them. I mean, you're gonna have a really close working relationship with somebody during a pregnancy, see them a whole bunch, and so finding somebody that you really can trust and get that good information from, I think is critical, and feel really comfortable asking those questions so that, you can make those informed decisions.
Yeah, so well said.
Yes.
We are in an age where information is readily available online. Let's
Oh,
call it
is it the right information?
ding ding. Let's call it social media. Yeah. You
That's
you
scary.
can get. I mean, you can have interactions like Dr. Metz is having with someone who claims to have all the qualifications of Dr. Metz and has zero. Zero. So I would say caution advised,
Yep.
caution advised. And if you have access to, again, someone that you trust that is either an obstetric gynecologist, your primary care clinician, a maternal fetal medicine specialist, and they are licensed in the state that you live in, there's a extremely high likelihood that they've been through a whole lot of schooling, a whole lot of education, a whole lot of training, and have a heck of a ton of experience. Give it a shot.
Why not?
Give it a shot.
Try some.
Go, try, see what happens. It might not be positive, but it might be positive. But at least give that a try, and then weigh that versus whatever you might be hearing online in regards to these topics. Any parting words, Dr. Metz?
I mean, I think we've talked about a lot of this stuff. I think as healthcare clinicians, we need to be really forthcoming in terms of limitations of what we know and what we don't know, and be welcoming to patients who want to talk about cannabis and pregnancy and the risks that we think are there. And to patients, I would just say, please do bring this up with your doctor, or your midwife, or your provider, so that they can have these conversations with you and make sure that you're doing the best thing for you and your pregnancy.
I love it.
Yeah, thank you. Thank you, Dr. Metz, for joining us today on
Thank
Empowered
you.
Voices for this important discussion, ever increasingly important discussion. Cannabis is a topic many people are hearing about regularly, and we hope today's conversation helped clarify some of the science and provided helpful guidance for expecting mothers and families. Thank you for listening or watching this episode of Empowered Voices. Be sure to subscribe wherever you get your podcasts, as another episode drops in a couple weeks. Also, don't forget to rate and share with others who may find our discussion helpful. We encourage you to visit empoweredmoms.org to share your thoughts about this episode or suggest topics you'd like for us to explore in the future. Thanks again. We were so lucky to
Thank
have you,
you,
Dr.
Dr.
Matt.
Matt.
Thank you.
If you live in Southern Nevada or in Weber or Davis County in Utah and you're pregnant or you've recently had a baby and are using opioids or stimulants for any reason, please know that you're not alone and you don't have to face it by yourself. Empowered provides compassionate, non judgmental support at no cost. You don't need insurance and you don't need a referral to get started. Simply visit empoweredmoms.org to learn more and request support. If you live outside of those service areas, we encourage you to reach out to healthcare providers or community organizations in your area. Help is available, and taking that first step can make all the difference.